Hello, my name is Dr. Kathleen Wolz, and I am a registered nurse. And my COVID story is as a patient's family. So on April 23rd, my husband suffered a stroke at home and was taken to the local hospital emergency room. I presently followed the ambulance as we all would do. And by the time I got to the hospital, to the emergency room, I came in through the entrance like that would be normal. And I was told that I could not see my husband. I needed to go wait in the car, and a physician or a nurse would contact me at their earliest convenience. There was no time frame given, no explanation except that it was the height of COVID, and the hospital had decided that no visitors was the best policy. So I went to my car and I sat, and I had no idea what was going on with my husband for about 20-25 minutes, and the physician called, gave me a report, which again was not positive. It was my husband was very critically ill, and that they were calling in neurosurgery and they were going to do some procedures and interventions. About 10 minutes later, the first hero nurse called me. I'm sorry, I don't remember her name. She was an emergency room nurse, and she started the conversation with, "I am so sorry that this is the way we have to communicate with you." She then went on, explained what was going on with my husband, how he was going to have a procedure done. She would let me know as soon as the people came to take him to the procedure. And in the meantime, she put the phone up to his ears, and I was able to tell him I love him and to wish him luck and to hang in there. Next came the procedure team. And the nurse went ahead and called me when the procedure team got there, had the procedure team talk to me, introduce them to me. So again, even though I wasn't physically there, the nurse did a really great job trying to include me as the family as part of it. Then my husband went for his procedure. Later that night, the physician called me, and my husband was sent to ICU on life support. And there was hero number 2, the nurse Darlene, who not only called me to tell me once my husband got settled, how he was doing, what his responses were, but she also let me FaceTime him. And it was the first time I got to see my husband since the ambulance drivers and the paramedics took him out of our home. So it was good to see him. At that point, he was a little responsive, so I did get a kind of a smile in the eyes and a little head nod from him. But he was on life support and he was sedated, so it was kind of hard to see him. So that was Friday night. Saturday, it was his nurse Sue, hero number 2, who was excellent and helped me kind of walk through it, gave me what was going on. I talked to the physicians, and every time they asked me a question, what did I need? My answer was always the same. I need to see my husband. I need to touch him. I need to kiss him. I need to say goodbye to him if that's going to be the outcome. Saturday, that was not an option. By Sunday, the nurse Sue called me again. A physician felt strongly, since my husband was not a COVID patient, he was a stroke victim, that I would be able to see him. So I got permission from the hospital to see my husband for 1/2 hour. At this point, we were starting to talk about removing life support and moving him to hospice. His nurse Sue was excellent. I don't think nurses understand when they provide families with information, honest information, to give them direction, to make decisions that are very hard for any of us to make, but especially difficult in these situations when I can't see them. She really was my eyes. She explained his color, his affect, what he was moving, what he wasn't moving. And that was so important to me because she humanized him. It was hard enough for me to sit at home and be concerned that my husband was not going to survive, but to have a nurse that was trying so professionally and so committedly to make sure that I stayed able to not physically touch my husband, but at least mentally and emotionally I was able to touch my husband. I was able to FaceTime him again, and then I was able to come in for 1/2 hour. And that 1/2 hour, just to see that he was being treated with dignity and compassion and to touch him and kiss him and say goodbye to him was really, really important to me as a family. The decision was made as to whether we were going to remove him from life support or not. And I will say his nurse, Sue, my hero, went through every test with me, explained every result, every doctor comment. So by the time the decision needed to be made, I felt as a nurse that I had all the information to make the best decision. That was on Sunday. On Monday, Mark was going to be removed from life support and transferred to hospice. Enter nurse hero number 4, Sarah. I got permission to go up to see Mark, and when I got there, she walked into the room with tears in her eyes and said how sorry she was, and then proceeded to ask me if I had any questions, and I said, I know I can only be here for an hour. And she said to me, Kathy, you can be here as long as you need to be here. No one will ask you to leave. There was such compassion and empathy in her voice, in her actions, in her commitment to Mark, in her professionalism towards me, that I think that she touched my heart without actually physically touching me. A lot of the nurses who I've known over the years came in the room and they did the elbow, they did the touch on the back. They were offering compassion as only nursing can. Nursing offers compassion through touch. It's so important for us. And these nurses did the best they could to convey that trust and that touching and develop that relationship while respecting the COVID-19 parameters during this crisis. I was able to stay with my husband until he was transferred to hospice. And I would just like to give a shout out to the paramedics that took him. My husband by this point was going to hospice. He was going to die. And the paramedics did such a nice job with treating him as a person. And I think that was my overall experience through this whole thing. Even though I couldn't be there, he was treated so much as an individual. He was very private. His privacy was respected. His treatment was very professional, very compassionate. The paramedic was excellent, even though the outcome was going to be the same. He treated Mark with, we're going to have oxygen going and all of those things, so that at no time would Mark have to suffer in any way or have to go without something. So to those paramedics, they were amazing. Sarah, the nurse, the ICU nurse, when I left, came over and hugged me. And I think for nursing, because touch is so important, I think that it made all the difference in the world. I needed them to touch me, and she did. And for me as a nurse, I needed that emotional connection with my husband's nurse. So it was a very important thing for me, and kudos to her. The other thing that happened while we were there is the nurses were FaceTiming patients with loved ones, and they couldn't get the iPads to work. And one of the nurses, Joanne, said, I'm done with this. I'm using my phone. I was amazed at the number of nurses that were using their own personal devices to communicate with families. The landlines in the ICU didn't work very well with patients with nursing with masks on. It was very difficult to understand them. It limited how far they could get into the room. Sometimes the iPads worked, sometimes they didn't, but it appeared like everybody's phone did work. So these nurses used their own private devices, then washed them and took them home. And truly a heroic move. My husband was then transferred to hospice, where my sixth hero is Bunny, the hospice nurse, who did a great job. She, again, very compassionate, very individualized, allowed me to stay with my husband the whole time. In hospice, they did allow one visitor all the time. So it was really nice for me. My husband lasted about 36 hours before he passed. And to all of those nurses who provided compassion and empathy and professionalism and touch and communication, those are the heroes. We talk a lot about nurses being heroes because they showed up for their jobs. It's not that they showed up for their jobs, it's what they did when they were there. And so, why I'm speaking about nursing, the physicians were excellent. I told you the paramedics were excellent. I think when you're a family member going through this and you're seeing this through the eyes of the family member, this was a horrific incident. It was a horrific time in healthcare when you put families secondary, or families were placed secondary to care of the patient. So to all you heroes, you did an excellent job and you made a horrible situation that much easier, and the ability for me to move forward. And for that, I thank you from the bottom of my heart.